As people grow older, many changes happen in the body. One of the most common changes teenagers face is trouble with sleep. Many older adults find themselves waking up at 3 a.m. or other early morning hours and wondering why. This can be confusing, frustrating, and sometimes even scary. But in most cases, there are clear reasons why this happens. In this script, we will talk about the most common reasons teenagers wake up in the middle of the night. We will look at how aging affects sleep, what health problems can cause this pattern, and what teenagers can do to sleep better. We will also explore when it's time to see a doctor and how to improve sleep through simple changes in daily habits. How sleep changes with age. Sleep is not the same throughout life. As we age, our sleep becomes lighter, and we spend less time in deep sleep. This means we wake up more easily and more often. Teenagers also tend to go to bed earlier and wake up earlier. This change in the body's internal clock is called a change in circadian rhythm. The circadian rhythm is like a natural timer in your body. It tells you when to sleep and when to wake. As we get older, this timer starts to shift. Teenagers may feel sleepy in the early evening and then wake up in the early morning, like 3 a.m. This is normal for many older adults. Common health conditions that affect sleep. Certain health conditions become more common with age and can disturb sleep. These include arthritis. Pain in the joint can wake you up in the middle of the night. Sleep apnea. This is when breathing stops for short periods during sleep. It causes poor sleep quality and frequent waking. Diabetes. High or low blood sugar levels can make you wake up suddenly. Heart disease. Chest pain or shortness of breath may disturb sleep. Depression or anxiety. Mental health can affect sleep patterns. Waking up too early is often a symptom of depression. Frequent urination. Nocturia, needing to go to the bathroom several times at night, is common in older adults. Medications and their role in sleep disruption. Many seniors take medication for various conditions. Some of these drugs can interfere with sleep. Common examples include blood pressure medications, diuretics, water pills, steroids, certain antidepressants. These drugs may cause side effects such as frequent urination, restlessness, or vivid dreams that wake you up. Always talk to your doctor if you think your medications are affecting your sleep. They may be able to adjust the dosage or switch to another medicine. Lifestyle habits that disturb sleep. Everyday habits can also make it harder to sleep well. These include drinking caffeine late in the day, taking long naps during the day, watching TV or using phones before bed, not getting enough physical activity. Caffeine stays in your body for several hours. A cup of coffee in the afternoon can still affect your sleep at night. Also, blue light from screens can confuse your brain and make it harder to fall asleep. Emotional and social factors. Loneliness, grief, or stress can also cause early waking. Many CNAs face emotional challenges such as losing a spouse, feeling isolated, or worrying about health. These feelings can lead to poor sleep quality. Talking to a trusted friend or counselor can help. Staying socially active and connected is also very important for both mental health and sleep. Natural changes in sleep hormones. Melatonin is a hormone that helps regulate sleep. As we age, our body makes less melatonin. This can make it harder to fall asleep or stay asleep. You can ask your doctor about taking melatonin supplements. In some cases, they may help improve sleep patterns. Tips for better sleep. Here are simple things CNAs can do to improve their sleep. Stick to a routine. Go to bed and wake up at the same time every day. Get sunlight. Spend some time outdoors every day to help your body's clock. Stay active. Gentle exercise like walking or stretching can help you sleep better. Limit naps. Try not to nap too long or too late in the day. Create a calming bedtime routine. Read a book, listen to soft music, or take a warm bath. Avoid heavy meals before bed. A light snack is okay, but a full stomach can disturb sleep. When to see a doctor. Sometimes waking up at 3 a.m. can be a sign of a more serious problem. You should talk to a doctor if you feel tired all day. You have trouble falling asleep most nights. You wake up gasping for air. You feel sad or hopeless. You fall asleep during the day without meaning to. Your doctor can check for health conditions, review your medications, and offer advice or treatment. Simple sleep-friendly home changes. Making your bedroom a good place for sleep can really help. Try the following. Keep the room cool, dark, and quiet. Use comfortable bedding. Avoid bright lights before bed. Keep a regular bedtime. Some people find white noise machines or fans helpful. Others like soft pillows or using blackout curtains. The importance of sleep for health. Sleep is important for healing, memory, mood, and even the immune system. Poor sleep can raise the risk of heart disease, diabetes, and depression. Getting good sleep helps CNAs stay active, think clearly, and feel better overall. Understanding REM and deep sleep. Sleep has different stages, including REM, rapid eye movement, and deep sleep. REM is when most dreaming happens. Deep sleep is when the body heals and grows. As we age, we get less deep sleep. This can make us wake up more easily. Waking up at 3 a.m. may be a sign that you are not getting enough deep sleep. This is not always dangerous, but it can make you feel tired during the day. Keeping a sleep diary and tracking your sleep habits may help you and your doctor see patterns. Sleep trackers and technology. There are many devices and apps today that help people understand their sleep. These tools can track how long you sleep, how often you wake up, and how much deep sleep you get. Using a sleep tracker may help you notice things you didn't before. For example, it might show that you always wake up at the same time or that you sleep better on days when you walk more. This information can help you make changes to improve your sleep. The role of nutrition in sleep. What you eat and drink affects your sleep. Some foods may help you sleep better, while others can disturb your rest. Foods that may help: bananas, which are magnesium; warm milk, which is tryptophan; whole grains, which help your body produce serotonin. Foods to avoid: spicy meals that can cause heartburn; caffeinated drinks like coffee, tea, and soda; sugary snacks before bed. Try eating a small, healthy snack if you feel hungry before bed. Avoid large meals late in the evening. Breathing and relaxation techniques. Breathing exercises and relaxation techniques can calm your mind and help you sleep better. Simple practices include deep breathing. Breathe in slowly through your nose, hold for a few seconds, and breathe out slowly through your mouth. Progressive muscle relaxation. Tense and relax each part of your body, starting from your feet up to your head. Guided imagery. Think about a peaceful scene, like a beach or forest, to help your mind relax. These practices can reduce stress and make it easier to fall back asleep if you wake up at 3 a.m. Building a support system. You don't have to deal with sleep problems alone. Family, friends, doctors, and counselors can all help. Talk about your sleep troubles with people you trust. Sharing your experience can make you feel less alone and may lead to helpful ideas. Support groups for seniors or health-related forums can also provide comfort and advice. Knowing others have similar problems can ease your worries and help you find solutions at work. The link between sleep and memory in older adults. Getting enough good sleep is important for memory. When you sleep, your brain processes what you learned during the day and stores it. Waking up too early or not getting enough sleep can affect how well you remember things. This is especially important for seniors because memory changes are common with age. Sleep helps the brain clear out waste and stay healthy. If you wake up often during the night or too early in the morning, your brain may not get the rest it needs. This can lead to forgetfulness, confusion, or even increased risk of memory-related conditions like dementia. To support memory, make sure your sleep is restful and deep. Keep a regular schedule. Create a peaceful sleep space, and talk to your doctor if you notice memory problems. The role of naps for seniors. Naps can be helpful, but only if done the right way. A short nap during the day, about 20 to 30 minutes, can improve alertness and mood. However, long or late naps can make it harder to fall asleep at night and may lead to waking up too early, such as at 3 a.m. If you feel tired during the day, try a short nap in the early afternoon. Avoid napping too close to bedtime. Pay attention to how naps affect your night's sleep and adjust your routine accordingly. Light exposure and sleep. Natural light helps regulate your internal clock. Getting sunlight during the day, especially in the morning, tells your body it's time to be awake. Dim lighting in the evening helps signal that it's time to sleep. Seniors who spend most of their time indoors may not get enough light to keep their sleep cycle on track. Try to spend at least 30 minutes outside each day. Open curtains. Sit near windows or use a light therapy box if sunlight is limited. Avoid bright screens before bedtime. The blue light from phones, TVs, and tablets can confuse your brain and keep you awake. The impact of alcohol and smoking on sleep. Alcohol and smoking can disturb sleep. While alcohol may make you sleepy at first, it can cause you to wake up late in the night. Smoking contains nicotine, which is a stimulant and can make it harder to fall asleep. If you drink alcohol, limit it in the evening. Try to avoid smoking, especially at night. Talk to your doctor about healthy ways to cut back or quit if needed. Good sleep is easier when your body is free from substances that interrupt your rest. Final thoughts on aging and sleep. Aging changes sleep, but it doesn't mean sleep has to be poor. Many seniors can still enjoy full, restful nights with the right habits and support. If you wake up at 3 a.m. often, take time to learn what might be causing it. Whether it's a health issue, a medication, or a habit that needs changing, solutions are available. Talk to your doctor. Try the tips in this guide and be patient with yourself. Your body is changing, and so is your sleep. But with small steps and care, you can find a pattern that works for you and helps you feel your best every day. Sleep is not just rest. It is healing, strength, and peace for the mind and body. Even if you wake up early, you can still wake up well. How pain affects sleep in older adults. Pain is a major reason many seniors wake up during the night. Conditions like arthritis, back pain, or nerve problems can make it hard to stay comfortable in bed. Even a small ache or stiffness can disturb sleep when your body is more sensitive at night. Some people find that certain sleeping positions help reduce pain. Others benefit from using supportive pillows or mattresses designed for pain relief. It's also helpful to do gentle stretching before bed or to apply a warm compress to sore areas. If pain is waking you up regularly, it's important to talk to your doctor. They may be able to recommend exercises, medications, or therapies that can reduce discomfort and help you sleep more soundly. Remember, good sleep is not about being perfect. It's about finding what works best for you and taking gentle steps toward rest, peace, and wellness. With care and attention, you can enjoy the restful nights and bright mornings you deserve.